to Franklin County Home Health Agency's Where the Heart Is. I'm Jennifer DeSablo, your host for today's show. Franklin County Home Health Agency is a nonprofit home health care and hospice agency that has been providing services to people of all ages throughout Franklin County since 1969. Through this monthly show, we bring you information about our agency's programs and services, as well as helpful tips to help you stay safe and healthy at home. Today we'll be talking about one of the agency's programs, the Hospice program, and I have a few members from the Hospice team with me here today. I'd like to introduce Liz Griffin, Reverend Liz Griffin, who is our spiritual advisor, and Annette Blanchard, who is our Hospice clinical manager. Sue Dewey is a Hospice certified licensed practical nurse on our team, and Nancy DeLude is our Hospice volunteer coordinator. So thank you, each of you, for being here today. We want to talk about hospice. There's a lot of myths or misunderstandings about hospice, and we want to clear that up for folks and explore that today. So Annette, being our hospice clinical manager, can you start us off with the definition of hospice and what people can expect?
Sure. Hospice is a program for patients who understand and recognize that they are reaching the end of their life and they want care directed at keeping them at home and comfortable and managing any symptoms, issues that they have to provide good quality care at end of life. It is an interdisciplinary program. We have a spiritual advisor, we have nurses, we have home health aides, we have social work, we have hospice volunteers, we have a medical director, and the entire group's focus, along with the patient and family, is to keep them at home and manage symptoms and allow them to die in the environment that they prefer.
Thank you. So talk about that a little bit. We are a home health care agency, so our services are primarily provided in home. And you mentioned people have heard of hospice facilities, but we are talking about hospice in the home.
Yes.
But you said they're provided in the setting of their choice. What does that mean?
Yes. We have patients that are in the home environment on hospice. We provide hospice care to residents at area nursing facilities. We provide care sometimes to patients in the hospital on hospice. So it is a program to help them die comfortably and peacefully in whatever environment that they're in.
Mm-hmm. That's a very special time to be a part of people's lives.
Yes.
You mentioned at the end of life. Can you talk about who is eligible for hospice care? What exactly does that mean?
Sure. The requirements for hospice, a physician has to certify and predict that the patient has a prognosis of 6 months or less. And sometimes that's harder than other times. Certainly any person can be on hospice with any kind of diagnosis, certainly cancer, end-stage lung disease, end-stage heart disease, end-stage dementia. As long as the physician and the hospice team feels that the patient has a prognosis of 6 months or less and they want care directed at their comfort, and they can be on the hospice program.
Okay, so let's talk about that care, that comfort care, and exactly what that is. You mentioned all the disciplines, and one of those being nursing, who are in there. So Sue, as a hospice certified nurse, what is the care that you provide to patients? And
we look at the patient, look at the symptoms they're having. If they're having, pain, we obviously take care of the pain. If it's swallowing difficulties, we work on that. We work on just anything to make it easy to be at home.
Mm-hmm.
We use a lot of our knowledge from past experience, from hospital care and that type of thing, that we can set things up with the family to address these symptoms. But mainly comfort. There's a lot of education, educating the family, sometimes listening to the family, and just making sure that all of their last days are comfortable.
Mm-hmm. Mm-hmm. Let's talk about we obviously are there to serve the patient, but in hospice it's a whole picture, the family. Can we talk about family involvement?
There has to be one person who, you can't admit someone to hospice if they don't have someone who's going to stand up and say that, I'll take care of you. We don't have 24-hour coverage. The nurse is available 24 hours, but not there 24 hours. And I think a lot of people don't understand that. They think once I'm on hospice, I'll have a nurse there, through the night and I can sleep okay. No, you need to have someone who's responsible and willing to take that role. And you're doing a lot of teaching because that person goes from being a spouse to a caregiver, or a child to a caregiver. And some people have a hard time with that transition, and for others it's very easy, very, this is the way it's going to be.
And we do a lot of work with the families on teaching them how to provide the care and making sure that they have medications in the home and they're prepared, and then they're comfortable providing that care to someone at end of life. And it's a team effort, and some families have 7 or 8 people that are involved in caring for their loved one, and some only have 1 or 2. And our goal is to supplement that care and to teach them how to provide the care and to give them that gift that they can do it at home, and the confidence that they can do it at home.
Yeah.
Like I would say empowerment of the patient and their family to feel good and secure and confident in what they're doing, because everybody's afraid. That's a scary time. We haven't been exposed as a society to that much death and dying in a family setting, and so people are really nervous. But when you have the team saying, yes, you can do it, we're there to support you, we're going to show you, whether it's 1 time or 10 times, how to do that transfer or how to change the depends, and give them the confidence that they need. People do really well, and they say, oh, I never could have done this without you, but we're just there to be the support, and they can do it.
It's a really good point. And you are there. You said you're not there 24 hours physically, but we are available by phone.
Right.
Is that correct? 24 hours, 7 days a week, somebody on the hospice team could be called?
Yes. It's someone on the home health team.
On the home health team, yep,
Yes.
Someone's available, okay. And then we also have, Nancy, volunteers, hospice, talk about hospice volunteers.
So people generally are very nervous about having new people come into the home. I mean, it's a very intimate, very special, very difficult time in someone's life. And so we want to reassure families when we're offering volunteers that they are trained, they're supported, they're supervised, and we do background checks. They're considered staff members of our agency, so they go through a 30-hour intensive training on all the different components of end-of-life care, and then, like I said, they're constantly supervised and supported. There's always a nurse back at the agency to give them any advice or help that they would need. So currently we have 36 volunteers, and they're all spectrums of life from, very in their 20s, I think, into their 70s. We have people that are retired, people that work, moms, dads, teachers, retired nurses. So it really brings a nice collaboration of different personalities and gifts and talents. And primarily they provide companionship and respite, but they could help people to go out, take a ride, write cards, take pictures. We can feed people if appropriate, help them to get around if appropriate. It's all based on safety and what is good and safe for the client and for the volunteer. So it's a wonderful program. And we encourage all of our clients and families to utilize that special group of people.
So a family can request a volunteer when they're on the hospice program?
Yes, they can, and we encourage them to do that. They don't have to make a decision that very first day for admission. Just like the rest of the plan of care, it's fluid. It's always moving, and it's always accommodating the special needs of the clients and their families. So maybe they don't want one today, but they might want one tomorrow or next week. So generally, they would go in from anywhere from 1 to 5 days a week, maybe an hour or 2 or 3 hours. We do see an increasing amount of volunteers going into the skilled nursing facility, the community care home, because it is hard to not be there with your loved one, and then how much harder if they're already in a facility. So they'll go and keep that person company,
So
where
while
they can
that
sit
main
one-on-one. I say now that the role of the volunteer has really become priceless. We don't have a lot of time to just sit and be present with someone. And at that time in their lives, that gives validation and testimony to the importance of that individual.
Yeah. Very well. And they do a long training, as you mentioned, and Reverend Griffin, you do some of that training as well.
Yeah,
Have you
I do.
been involved?
Yep.
Talk about your role as a spiritual advisor. One, what you do in the training, how you help volunteers understand the spiritual aspect, and then what you do for families as part of their care.
Well, I participate in the volunteer training on 2 different levels. The first time as part of a team, we all go in together and introduce ourselves and talk about how we are a part of the hospice program. The second part is we talk about what it means to be, quote unquote, a spiritual advisor for someone who is terminally ill in their family. And it's not what I'm doing, it's what people ask me to do. I am available for people to meet their spiritual needs. Many people have their own pastors, have their own clergy people who are involved in their lives, but people don't. And so I am available for people who either don't have their own clergy person or would prefer to speak to someone who they don't know, who has a distance from their own family life. And what do we talk about? We can talk about anything, from the weather to, well, I got a terminal diagnosis. Does that mean I'm going to die in 6 months? And then 6 months comes and they say, well, gee, I'm not dead yet. And so we talk about a lot about what it means to be dying.
Yeah.
Do you reflect on your life? How do you present yourself to your family? Will it hurt? Is God mad at me? All those sorts of strange array of questions and concerns arrive. And I see my role as simply to listen to people's concerns and find ways to address them in a spiritual and theological context that's appropriate for the particular individual. Some people have very profound faiths, and some people vaguely have an understanding of what their faith might be. And so it's a matter of speaking to that need and trying to find a way to help people find peace, whether it means saying goodbye to someone or saying I'm sorry or saying thank you. It's very amorphous. There's no script. You have to be willing to understand what people's needs are.
Yeah.
And the other thing is that sometimes I talk to people's families as well. Children sometimes, or spouses. Why is this happening? Why does she have to suffer? Why does he have to suffer? And sometimes these questions have no answers, but they need to be discussed. And then sometimes I'm just there. And that's all that's important too.
Yeah. What a comfort, what a gift that you can give.
It is a gift,
Yeah.
and it's a gift to receive, to be with people. And I always tell people that it's unfortunate, but sometimes I only meet people at the end of their life, and that's kind of, at least I've met them a little bit,
Yeah.
you know.
Yeah.
So
We matter. There's a quote in hospice and a lot of the literature all the time that you matter to the last moments of your life. So that really brings validation.
what makes me sad is that people think that if they, and I don't know where this comes from, but people often think, well, gee, if I'm on hospice, that means I'm going to die in 6 months. That means I'll be dying in April, you know. And people have this notion that it's a death knell, and it isn't. A hospice is not telling you you're going to die now. Hospice is a way of community coming together to support each other at a time of need.
In a natural part
In
of
a
our
natural
life.
way. I mean, this is what life is about, folks.
And I think you raise a good point in that it is not a script, and that each person and family has a unique process that happens. Their disease process kind of goes along with what happens, but we are there to provide support and to help them on the journey and to prepare them for what to comes. But it's an individualized process, and that's what's so important about hospice is we are there for them to help them along their journey.
That's right.
It's not a script. It's not this happens. This.
No, there's no preconceived plan that
Yeah.
you're going to go in and follow.
Yeah.
Yeah.
You have to very much be willing to be flexible
Yeah.
and open
Present.
to whatever
Every
happens.
person's unique
And respond to the
experience.
person's needs. And
Absolutely.
sometimes that response means that they don't want me there.
Yeah.
And that's okay too.
Good. Yeah. Let's talk about, you mentioned that the timing when they say here 6 months or something. So what are the importance of getting on hospice early? What is early? And you know, what does that mean as far as some people come on later in their prognosis? Can you talk about that aspect of timing?
You know, dying is a journey that we all have to take, and we live in a society where medical care is getting more and more technology advanced, and so patients are living longer with whatever disease that they have. Sometimes it's very difficult to know and recognize when you're approaching the end of your life, and it is our hope that families and loved ones and patients can start having those conversations earlier and start thinking about the goals for the end of their life. Where do they want to die? Do they want hospice? And you know, most people, if you ask them, will say that they want to die at home, yet hospice utilization is very low in the state of Vermont. So our goal is to try to get patients and families to start having these conversations and recognizing that their disease is approaching end of life and that they are appropriate for hospice, and start understanding that at some point medically you can only do so much, and now it's time to focus on quality and comfort and support to the family.
But I think this conversation has to start long before somebody's sick, and that's the problem.
Yes.
People don't want to do this. I remember, and I speak anecdotally, my father-in-law was sick, his wife was getting sick, and he said, this is what we have to do, and he had the courage to take all the steps necessary to prepare him and his wife for their end. And very few people want to do that. They don't want to look at it and face it and say, we need to plan this. And having an advance directive is the way to begin.
Absolutely. And
Because
we
it
are
gets you
lucky.
start thinking about it.
Absolutely. And we have a program that we offer to our community and to agencies in our community called Start the Conversation,
Yep.
which is exactly what you're saying. We need to start that conversation early. We could all have that conversation with our families so that you're talking about it early, and when that time comes, it's less scary and more questions might be answered ahead. So folks, certainly, I'm sure you've been involved and know you've done some training on that, and going out there and letting people know, here are the questions you should be asking, talking about with your family, and just get it started. Absolutely. Talk a little bit, we haven't talked about hospice care beyond death, what the hospice program offers to families and patients, or to families after death.
Part of our focus is making sure and offering support to the loved ones of the patient who has died after the time of death. And we look at the risk factors might be for complicated grief, and put a team together to follow up with that family, whether it's by phone call, whether by visits, support group, volunteer visits, and we help them through that time of grief.
And that lasts for how long?
Up to 13 months.
That's a really good gift to the family.
And we have our grief support group meets twice a month at our agency office, and we have hospice families that come, and we have community members that also come to that group.
So anybody
Reverend Liz is
experiencing
involved
grief.
in following up for bereavement. Sometimes it's our home health aides that will go and visit families.
Sometimes one particular staff member connects with the family, and I've heard many times from family members that, you know, so-and-so stopped by and it was just so nice that they were able to stop, and or if I talk with them, can you it's often the nurse's aide, can you tell, you know, so-and-so that that we said hi. But it's just nice for the family to be able to talk about their loved one, and some of their concerns and some of their, you know, I thought I couldn't do it, but you were right, I could do it. And it is just nice to follow up with them, and it means something to them to know that the patient mattered to us.
Exactly. Now, as a hospice nurse, a hospice certified nurse, and at Franklin County Home Health Agency, you do home care and hospice. Can you talk about how those rules differ and the value of doing both?
Okay. I know different people have different thoughts about what hospice is, and we talked about the home versus in a facility. Basically, with the hospice patient, you're taking care of the family, you're taking care of the patient and their needs, working with the doctor, and if I have any questions, any concerns, I'll speak with Annette, the manager, and we'll, you know, approach the doctor. But there's a lot of family-based and educating the family and working with that. With a regular patient, we see them for 6 weeks, maybe 6 months, you know, depending on what they're being seen for. And we basically work with the patient, follow orders from the doctor, you know, and we'll see the family, but it's mainly getting them independent with their care and discharging them. With hospice, there's a lot of, we know what the end is going to be, and there's a lot of, as you said, listening. if I can just say something also about signing up early, a lot of the first couple of weeks of patients on hospice, there's a lot of education, a lot of changes, a lot of equipment, a lot of just different things going on. The last few weeks can be very peaceful, very, you know, the family has accepted, the patient has accepted, everything is just going along nicely, if you can say that. If that is too close together, you know, it can be hectic. It's nice to see that piece. It's nice to see that the family and the patient and everyone come to terms with you know, the end is coming, and so when they sign on sooner, you see more of that.
Sure. More time.
You're able to
adjust.
build better relationships, and that's really what it's all about, is forming a really wonderful relationship to provide that exceptional care, and that takes time. I mean, it's very difficult to do that in 48 hours or less.
Or less, right.
Let's talk about some of the other things you've talked about, things that people might be considering at the end of life that they never thought about. What did I do with my life? What kind of things? I've heard there's a program for adults similar to making a wish for someone on their bucket list. Can you talk a little bit about how you've seen some of that happen in hospice, where somebody said, I've always wanted to do X, Y, Z?
Sure. And our social workers play a big part in this. You know, their focus is talking to patients and their families about life experiences and what haven't you done that you'd like to do, and who would you like to be here and isn't here. And we've utilized the Dream Foundation to get family members who wouldn't necessarily have the funds to come to Vermont to be with a person at end of life, to make that happen. We recently had a patient that all he wanted to do was go to a NASCAR race and meet his favorite driver, and didn't have the resources to make that happen. And our social worker worked with him and worked with the Dream Foundation and made it happen. And he went to the races for the weekend, and he got to meet his favorite driver and talk to him about his life experiences. In fact, they shared us, you know, a little bit of a story of the driver's parent who had died. So it was a wonderful experience for the patient and his wife. He got to spend some time with his own family, and it was a great experience for our social worker to know that she could play a part in that.
Yeah, that's really great.
Excellent.
That's excellent. That's good. We've been talking a lot about signing up and being on. I think we just need to recap exactly how that happens. If you are a family member who is someone who's very sick or is thinking about the end of life, or an individual, what are the first steps? What happens?
The first step is to call our agency and, you know, ask to talk to me, ask to talk to our intake nurse, and talk about hospice. Talk about your wishes with your family and your loved one. Certainly we need the physician to give us an order for hospice, but the physician does not have to be the one to start that process. So we get calls all the time from families and loved ones.
Good. And then as far as being a volunteer, folks, you said you have over 30 volunteers now. I imagine you always want to keep that roster.
Oh, absolutely,
growing.
absolutely. We want to be able to have a really good pool to match the best personalities and interests and things like that. So we'll be having our next volunteer training next spring. It will likely start in April. Anybody that might be interested can either call the agency and ask to speak to me, or email me through the agency, and would love to have people attend.
Wonderful. And if you are a hospice volunteer, what could you be someone who works full time? Who are you?
Oh,
you did mention the
absolutely.
types of volunteers,
Yes.
but what kind of hours you're willing to give? And
I say up to 8 hours a month would be great. I mean, with the type of program that we have, it's sort of fluid because it's all on patient what they need. But if there's a time when we don't have a patient visit for someone to see, they can also help with fundraising activities to promote hospice and our agency. They can help out with administrative duties, help with printings, mailings, things like that. So there's a variety of things that a volunteer can do. We just had a wonderful group of volunteers come together to help with our Blue Jean Ball which has been
There's
wonderful.
invaluable support.
Yes.
That's great.
Yes.
Good. And then I want to thank you all for the work that you do in hospice, of course. Everybody brings some expertise at a different level. We have a wonderful team, as you mentioned, the interdisciplinary team of all the different caregiving that we offer at Home Health, from social work to home health aides to nursing. So thank you all for that. And then Sue, I want to congratulate you because you recently, in the past year, received hospice certification. So as a nurse, our nurses can do home care and hospice, but the hospice certification is another level of expertise. Can you tell us a little bit about that and what it entails?
Okay, so hospice is something I've always had an interest in, and some people are more comfortable with it than others. One of my managers mentioned that you can become certified, and so I looked into it a couple of years ago, thought about it, read up some more about it, and it's quite the process. I'm not a test, I hate taking tests, but after I looked at the content, I thought, I can do this. A lot of it is experience, and I think that a lot of the nurses that I work with, even though they're not certified, they're very good hospice nurses. But the certification just says to the state and to everyone out there that I took the exam, and I was able to, I qualified for the certification.
Yeah, well, congratulations to you
you.
and all the staff who go that extra effort to do that. We haven't mentioned, we should mention about Medicare and how hospice is paid for, and some history there.
Reimbursement for hospice. If you are a Medicare recipient, it is, as long as the physician is certified that you are appropriate for hospice, the services that we provide are covered by Medicare at 100%. Skilled nursing, home health aides, Reverend Liz, social worker, any equipment that is needed to keep you comfortable, medications related to symptom management, all that is covered and reimbursed by insurance. Other insurances also cover and pay for hospice, Medicaid, third-party insurances. If you have no insurance, then you are still eligible to receive hospice services. So.
That's wonderful. Thank you for sharing. We're running out of time, so before we close, I want to ask anybody if there's anything else you'd like to share about hospice or home health.
So hospice affirms life, first and foremost. Just want to underscore that, and that we're taking care of people's physical, spiritual, emotional, and social needs.
Yeah, excellent. Thank you.
I think that many times families and patients don't want to talk about hospice, and they want to wait for the physician to bring it up. I encourage people to be their own advocates, and if they feel like it's time to start having those discussions, then start talking about it. And most of the time you will find that the patient is thinking about it, and it's okay. It doesn't have to be the elephant in the room.
Well put. Thank you. Well, thank you all again for being here and talking about a very important program through Franklin County Home Health, our hospice program. And for anybody watching who has any more questions or concerns, they can check us out online at www.fchha.org and learn about hospice, or feel free to call our office at 527-7531 and speak with Annette or Nancy or anybody there with questions about hospice. And as Annette said, talk with your family or your physician. We encourage you to keep watching our show and learn about what Franklin County Home Health Agency offers to you. We also keep people safe and at home and help you recover from illness or injury at home. So please feel free to call us or check us out online. And thank you for watching, and be well.